medical professionals of Reddit. When did you have to tell a patient, "I've seen it all before," to comfort them? But really, you had never seen something so bad, or of that nature.
Not medical professionals, but we were the patients. My daughter, who was 3 at the time, had to have a cavity filled. As we were leaving, the dentist told me just to watch my daughter because sometimes kids chew their gums because it's numb and feels weird. So the drive home took 30 minutes, and I had been talking to my daughter the entire time to keep her busy. I park my car in my driveway, open the passenger seat to get my daughter out, and her entire lower lip on the left side is gone. She had chewed it off down to her chin. She ended up in emergency surgery, but the surgeon kept telling us it would be fine, and he sees this stuff all the time. She ended up having multiple surgeries, and when she was finally healed, the surgeon told us that it was the worst injury like that he had ever seen. He wasn't sure how she would heal, but you can hardly tell it happened now.
Probably too late to the party, but I had a lady come in to the ER listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood tests, results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone, and her body was twisted in a decorticate position with her jaw locked open. Then the smell hit me. Rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm, and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to oozing muscle fibers. Her calves were incredibly swollen, and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. Her entire sacrum was exposed, and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar, no surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. I showed up to a house for a possible overdose. 3 firefighters and a police officer were on top of a man who was prone and naked from the waist down. They immediately told my partner and I to restrain the patient to the gurney because the patient was combative. It turns out he took something thinking it was weed, but turned out to be laced with something else, possibly PCP. During his trip, he attempted to cut his penis off, but wasn't successful. As fate would have it, I knew the patient personally and tried to comfort him on the way to the hospital. During the ride, he became somewhat cognizant and was ashamed of himself. I tried to comfort him as I held his penis in place. I would be lying if I said I had seen a severed penis before.
I'm a nurse and I work in a pediatric ER. A young woman brought her baby in to be seen for vomiting. I asked her to put the baby on the scale. While on the scale, I noticed a strong odor of bug spray, so I asked about it. Mum, a roach crawled into her mouth, so I sprayed a little Raid in there. She said it matter-of-factly, like it was no big deal. Quay up calls to the police, CPS, and a one-to-one sitter for the child and the mum. When all was said and done, the baby was fine and turned over to her grandmother, so no worries there. I have no idea what happened to the mother. I don't believe she was intending to hurt the child. I think she was just butt-ass ignorant.
A little late to the party. Not the worst, but I had a patient once with a stomach bleed and a small bowel obstruction. We had to put in an NG tube that goes in your nose and down to your stomach, to drain, decompress his stomach, which was pretty distended and hard. I'm inserting the tube, and as soon as it hits this guy's gag reflex, he projectile vomits. and sprays very dark, half-digested blood all over himself, the bed, the wall, and the floor. It's basically a scene from The Exorcist. I had to dive out of the way and somehow was unscathed. He couldn't stop for almost 10 minutes as we're trying to get this thing down to where it needs to go. Finally, finish placement, and it immediately suctions out approximately 3 liters of this black sludge that is old, digested blood. PT was mortified, and we had to play it off like, oh no, it's fine. It's really common to vomit during the procedure. We'll just go get some towels and clean you up. My coworker and I left the room and just stared at each other in silent shock.
Had a patient who needed a lower GI study to fix a bowel bleed. To get a study done, you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, I kinda wanna try and poop. He said it so casually, I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of poop. In my 9 years, I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes and sopped it up. Told him this happens all the time. Edit. Thanks for my first gold. Edit to my edit. Thanks for my first platinum and all the kind words. I love what I do. As a new nurse, I worked on a nephrology unit, which meant that we dealt with mostly patients who had kidney failure and needed hemodialysis 3 times a week to clean their blood. A patient was admitted through the emergency room and told me that he hadn't been to dialysis in 4 weeks. He had HIV, kidney failure, had lost custody of his kids after a messy divorce, and had no will to live. He planned to just stay in his home until he died. He probably wasn't far from it, but a neighbor, who hadn't seen him for a few weeks, peeked in the window and saw him sitting, unresponsive, on the couch. They called 911 and he was brought to my hospital. 3 weeks is an insanely long time to go without dialysis. Dialysis removes toxins and excess fluid from your blood. Missing a session can leave you feeling sick and swollen. Missing 12 sessions can kill you. This guy was so swollen. I've never seen a person who was so full of fluid. He looked like that girl from Willy Wonka that turned into a blueberry. His feet and ankles were particularly massive. I wasn't sure that he'd live. Miraculously, after several dialysis sessions, he'd fully deflated. However, he was left with lots of loose skin afterwards, which had the fragile texture of an old balloon. One night, he called me to his room and said, I think my foot is bleeding. He was right. He'd slid down towards the bottom of his bed and used his legs to push himself back up towards the top. In doing so, the fragile skin on the bottoms of his feet had been totally sheared away, leaving only tissue and bone and so much blood. I had no idea what to do, so I just called a code blue. The patient wasn't dead or dying, but no part of nursing school or practice had prepared me for an HIV plus patient who had ripped the soles of his feet off and was currently laying in a 3-foot wide, rapid loo, expanding puddle of blood. I just needed to get a whole bunch of people to the room as quickly as possible. I threw on a waterproof gown and some gloves and held pressure on the bottoms of his feet with a towel until help arrived. They didn't know what to do either. We called in the general surgeon, who seemed to think we might be exaggerating the extent of the damage and blood loss. He told us he'd be there in an hour and just to hold pressure until it stopped bleeding. We soaked towel after towel until finally the surgeon shows up. He breezes into the room, moves my towel away and says, "Humph." Then he reaches towards the patient's foot and pulls off a huge, softball-sized blood clot. In that moment, time stopped. He held out his hand, holding the huge clot, and I, without really thinking about what I was doing, held my hand out too. He plopped the clot right into my outstretched hand. In the next moments, several things happened all at once. I realized I was holding a big, coagulated mass of blood. I started dry heaving. I dropped it on the floor. It splattered. The surgeon exclaims, "Oh, Jesus, fuck." Not in response to my gags or the fact that he was just splattered by the clot I dropped, but because the patient's foot is now profusely bleeding again. He darts off and tells us to get the patient down to the OR immediately. We get him down there and, on the way back, realize that he'd left a trail of blood down the hallways, into the elevator, and to the operating theater. I saw the patient during my next shift and he jokes, "I thought you were going to pass out when the doctor handed you that mess." To which I replied, "Sir, I was positive that you were about to bleed to death."
As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me. He just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat, and I'd make sure someone was with him right away. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me. He just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat, and I'd make sure someone was with him right away.